Hello. Hello, Alex.
Hello, Frank. Can you hear me?
Yep, I can hear you.
Great. Excellent. Sorry, just a couple of technical difficulties. All right. You can.
Sorry, currently I cannot hear you.
You cannot hear me.
Okay, I can hear you now.
Okay. Great. So sorry, I just quickly set this up. Great. Okay, guys. Welcome to this webinar. So the title of today's webinar is "What Causes Bunions and How to Treat Them Without Surgery." We're very lucky today. Frank Howick from Smile Podiatrist is here to join us, and he's going to share his expertise on the subject. Why we've chosen this topic is because quite frequently at my physio practice, a lot of you guys ask me, bunions seem to be quite a common problem. So a lot of you guys keep asking me, I've got bunions, what can I do about it? A lot of you guys obviously don't want to have surgery, and you're looking for a way to treat it without surgery. And to be honest, this kind of falls outside of my expertise. So therefore, I've reached out to Frank, and I've asked him to come along tonight and share his knowledge so that you guys can benefit from it. Now, before we actually get started, could you guys on this webinar, could you just tell us if you can see and hear us properly? So you can just type just say hello in the chat box down the bottom on the right hand side. If you can just say hello or just acknowledge that you are there. Hi, Benny. Great. Hello, Ray. Perfect. Okay. We're good to go. All right. So, Frank, first of all, could you just introduce yourself? Just tell a couple of things so people know, a little bit about your background.
Hello, everyone. My name is Frank Howick, podiatrist in the Smile Foot Care. My clinic is located in the corner of Pakrama Road and the Kosama Drive. Nice to meet you. Great.
Okay, guys, by the way, just a little bit of house rules. So you can type in your questions as we go along. We'll probably come back to your questions right at the end of the webinar so it doesn't disrupt the flow. But yeah, the fact that we're not answering your questions immediately, that doesn't mean we can't see them. We're just going to come back to your questions right at the end of the webinar. Okay, so feel free to type them in the chat box. All right, so Frank, let's get started. So can you just give us like a bit of an intro? Like, what are bunions? What are they?
Okay, so bunions are bony bumps that form at the medial surface of the big toe joint, which is called the first metatarsophalangeal joint. So bunions develops as a consequence of the first metatarsophalangeal joint deformity. So in this joint, can you see this joint is called the first metatarsophalangeal joint. So in this deformity, the head of the first metatarsal bone, this bone is the first metatarsal bone, the head of the bone moves toward the middle line of our body, and the direction of our big toe moves the opposite way. So the bony prominence develops around here. So we call this deformity actually hallux valgus. So bunions are one phenomenon among many others caused by hallux valgus deformity. And one thing you need to know is that bunions are progressive deformity, which causes many secondary foot issues, such as hematoe-cloto deformities. And also, especially among the elderly population, bunions are an independent risk factor in falls. So I strongly recommend those who have bunions to see podiatrist. Okay. Next question.
So what are the actual causes of bunions? Like, are there certain risk factors that kind of predispose you to having bunions? Are there certain things that you can do to prevent them?
There are many theories about how bunions, more specifically how hallux valgus deformities develop, but the exact cause is still unknown. However, risk factors of bunion development include age, ill-fitting shoes, abnormal foot structures, ligamentous laxity, and bone hypermobility, and also Achilles tendon tightness. So in my opinion, any abnormal stresses exerted on this first medial side and the bottom of the first metatarsal joint could be related to developing bunions. Also, many people believe that heredity might be also related to bunion development. So in terms of the bunion, how to avoid bunions, as I mentioned earlier, we don't know exactly what causes bunions to form yet. But generally speaking, it's a good idea to avoid anything that increases load on the first metatarsophalangeal joint, which is a big toe joint. So in this light, spending too much time on high heels is not recommended. So I strongly recommend people to choose shoes carefully. Shoes should have a wide toe box, and those shoes should have space between the tip of your longest toe and the end of the shoe. Also, shoes should conform to the shape of the feet without squeezing and pressing any part of the foot. Okay?
So, needless to say that high heel shoes are probably bad. You know, it puts you at risk of
definitely. When we high heels, our foot is positioned in this way, so a lot of load is focused on this joint, which could be related to development of bunions.
Right. And it seems like most people that I see with bunions at the clinic seem to be females, probably 40 plus, and probably history of wearing high heels.
Definitely. Yep.
Would you say that that's the kind of the high risk group of people that tend to get it?
I cannot say high heel is directly related to the development of bunion, but anyway, it is a kind of risk factor, and also age is related.
Okay, right, and females are obviously definitely more at risk than males.
Yep.
Okay. Another question that I keep getting as well is, you know, some people, they know they have this deformity in their toes. They're not quite sure what it is. I mean, some people don't even know it's a bunion. And I think there's a bit of confusion. What is a bunion? What is arthritis? What is gout? Like, you know, I mean, I know what it is, but, you know, can you explain to people, you know, because gout also tends to happen in that big toe and the ankle joint. So sometimes it can be confused, and it can also cause a bit of swelling. So what is the difference between a bunion, gout, and arthritis, and how can you tell a difference? Like, can anyone sort of, are there certain features that people can actually watch out for, and to tell them what they actually have?
Sure. First, arthritis arthritis is a quite broad term of joint deformity. And the first metatarsophalangeal joint is quite vulnerable to many types of joint diseases, such as osteoarthritis or inflammatory arthritis. So, as I mentioned earlier, bunions are a secondary complication of joint deformity. Okay.
Right.
Next, gout. Gout is a form of inflammatory arthritis characterized by recurrent attacks of a red, tender, hot, and swollen joint. So, when the first metatarsophalangeal joint attacked by gout, it is often mistaken as a bunion because they have quite similar appearances. Okay, but the cause of the swelling is totally different.
Okay, and I think the other thing about gout as well is that it tends to be triggered by certain types of foods that you eat, isn't it? So if you feel like every time you have a glass of wine or a bit of cheese or a bit of seafood, and it makes the pain worse, then you're more likely to be.
Those food increases our urine acid in our body, and so uric acid accumulates mostly in that joint, which triggers gout. Right.
Okay. And what are corns? What's the difference between a corn and a bunion?
Corn is a kind of a horny thickening of the skin caused by friction and pressure. It's a quite common complication of the bunion, which is a hallux valgus. So when we have bunion, actually when we have a hallux valgus deformity, sometimes the big toe override our second toe. So there are many cones develop on here and any other top of our digit. So it's a kind of secondary complication of the bunion deformities.
So they can coexist together?
Yep.
Right. Okay. All right. So now that we've kind of established what bunions actually are, what are the ways? I mean, I know that if you go and see a specialist, that the likelihood is that they'll probably refer you to the surgeon, who is more than likely they'll offer you to perform a surgery. And from my experience, I think the outcomes of surgery can be the mixed outcomes. So I think most people would prefer not to have surgery. So in terms of non-surgical treatment, what can you offer in podiatry? What can they do to, first of all, ease the pain, and second, to a certain extent, correct the deformity?
Sure. So before we discuss the non-surgical treatment options, we should understand how bunions affect our foot. So the hallux valgus, the hallux valgus causes symptoms in three particular ways. First and foremost, the pain in the bunion, the pressure-sensitive prominence on the medial side of the head of the first metatarsal joint. So it hurts to wear a shoe. Furthermore, the valgus deviation of the big toe often results in a lack of space for the other toes. So they become displaced upward, leading to pressure against the shoe. This is termed hammer toes and claw toes. And finally, normal function of the forefoot relies heavily on the great toe pressing down on the ground when we walk. So since the valgus deformity stops this happening to a sufficient degree, metatarsal head from the 2nd to 5 are overloaded. So the resulting pain is often called metatarsalgia. So in my clinic, I use various types of bunion paddings to relieve pains. So for example, I will show you. This is one type of bunion padding. So you can see there is some gel here to reduce the pressure against the shoes.
Right.
And this is another type of bunion padding. So it separates the big toe from the second digit and also provides some cushioning here. So
Right.
these bunion paddings are quite often used. And also, we use special shoes to relieve the pain. So for example, this is a kind of medical shoes. So it is made of premium leather, but can you see here? We have different materials, soft and stretches to relieve pain. So the first line of treatment is to relieve the pain using the paddings and also special shoes.
Mm-hmm.
And also, we often use this kind of insoles. I mentioned earlier that any abnormal pressure on this joint might lead to bunion development. So using these insoles, we try to spread any load. We try to use this to reduce and spread any abnormal forces exerted on the foot. And also, many people have secondary complication. People have cones and very hard skin. So in the clinic, I remove the hard skin and cones to relieve pain with the scalpel. So those are mainstream of non-surgical treatment options.
And so for someone, let's say for someone with severe bunion, do you think these methods of treatment that you just outlined, do you think would that be still effective? Is that worthwhile giving it a go?
So in terms of pain relief, most cases we can resolve the problem with the treatment options I already mentioned.
Mm.
But in terms of realign the joint, we cannot realign the joint in non-surgical way.
Right. And would you say, on average, that the treatment that you offer, how successful is it? What do you know? Like, is it? I'm not sure if you know the percentage rate, but what are the chances if someone comes to you with a bunion and you give them the splints that you've just shown us, or the orthotics? What's the probability that they'll actually get significantly better?
I haven't calculated the ratio of the percentage, but most case we can resolve the pain or any symptoms quite successfully.
Right. Okay. So more than half.
Yeah, sure, definitely more than half.
Yeah. Okay.
Almost, yeah.
Yeah. I've got a question here from Kim. Now she's asking, so is there something you can do to minimize the swelling associated with bunions?
Sometimes the swelling is involved because the friction between the shoe and the skin sometimes causes inflammation of the we call bursa fluid of sac. So in that case, if we reduce any friction, any pressure exerted on the joint, the swelling eventually will go down.
Right. Would you say, like, just let's say if you go to work and you have bunions and it gets sore at the end of the day, would you say like icing it? Would that be helpful?
Definitely, yeah. Icing is could be helpful, reducing the symptoms, the pains. Yeah.
Right. Okay. Okay. Cool. Do you guys have any questions about the treatment at all? You can put them in there in the chat box. Right. So, so we talked briefly about what things can be done to avoid bunions. But anything else that, if someone comes to you to the with a bunion, anything that you can advise to stop the bunions from getting worse? Is there any tips that you can share with us?
So, as I already mentioned, any abnormal stress load put in this joint will eventually aggravate or eventually cause the development of bunions. So we should avoid any activities, anything that increases load in this joint. So avoid any ill-fitting shoes, and sometimes the people's feet slightly pronated, increasing the joint pressure here. So I strongly recommend this kind of medical insoles to correct the foot position. Those are good ways to slow down the progression of the bunion development.
Okay, we get some people who play sport, like runners, or they might play tennis, squash, golf. Would you say if they suffer from bunion pain on a consistent basis, would you say that they should stop playing sport and get it treated first?
I don't think so. So as long as we can manage the level of pain, they can still enjoy their sports activities. So right. I don't recommend. So I don't say they should stop the activities to relieve the symptom.
So basically, if you're playing sport and that the bunion pain is really bothering you, go and see Frank.
Definitely.
He'll manage the problem.
I will try to help you. Yeah.
Okay. We got some questions here again. So what other pain relief methods can you advise apart from icing and what you mentioned? Is there anything else that you haven't?
So the main cause of pain is pressure, friction between from the shoes. So when the friction and the pressure is strong enough, the skins become inflamed. So sometimes you can take anti-inflammatory disease and drop the medicines, and also you can use icing, and also we can use padding, and also when it is really inflamed, you should just let it rest.
Okay. And obviously when it comes to taking anti-inflammatory medication, you should advise with your doctor.
Sure, definitely, yeah.
Any reactions or anything like that. There's another question is, so you don't advise running a lot. So I think we came to the...
I wouldn't recommend running. So running is not different from the bunion, okay? So as long as your foot posture is all right and you can enjoy running, you can run.
Yeah.
Some people has quite abnormal foot shape, then the foot should be slightly corrected.
Okay, right. So you basically need to, go and see you, get the orthotics, make sure your running shoes are exactly the type of shoe that you that you need, because we all have different feet, and I always advise my patients to go and see, go and buy shoes from places like Shoe Science, Shoe Clinic, or Athlete's Foot, where they actually put you on a treadmill and they get you to run or walk, and they have special video equipment that actually helps to analyze how you walk, how you run. So they give you the shoe that's right for your foot. I think that kind of goes along with what you were saying as well, that you should pretty much the solution should be tailored to your situation, I guess, isn't it? So
sure. So every treatment option should be tailored.
Yeah. Okay. Cool. No, that's great. So, just gonna go to the. Okay. So, sometimes it gets so bad and severe that pretty much everything else fails. And when would you say that someone actually needs to have surgery? Is there a certain threshold? Is certain, criteria that you have to meet where you say, okay, look, I can't help you. You actually have to go on and have surgery.
Sure. So bunion surgery is recommended only when non-surgical measures fail to relieve symptoms and the bunion interferes with your daily activities. So, however, surgery is not recommended to prevent the bunions from worsening or for cosmetic reasons, because surgery always involves risks and complications, and also full recovery time might take up to 1 year. So surgery is only recommended when everything fails to relieve the symptoms.
So it's like the last resort, essentially.
Exactly. Yeah.
And what again, like I'm not an expert in this area, but I've realized there's a couple of types of surgeries, isn't it, that you can do? One type where they actually have to break the metatarsal bone and kind of reshape it. Is that correct? Is that?
Sure. Yeah. So there are various types of surgery, but basically they involve realigning the metatarsophalangeal joint at the base of the big toe and correcting the deformity of the bones, making of the toe and the foot. So it involves making small cuts in the bones and the fixing with pins, screws, or plates, and repairing the tendons and the ligaments around the big toe. Those are mostly common procedures involved in the surgery.
Right. Would you say that the outcome you mentioned about, you know, that it generally takes about a year to get over your, you know, to recover from the surgery? I mean, I remember clearly one patient that I was seeing, she was a runner, but her bunions got so bad that like she had to have surgery. And I think it did take her about 9 months before she could actually run again. Would you say that this is a typical scenario? Like, is that if someone is an active person and they want to get back into running or playing sport, would you say 9 months is generally how long they sort of they look to you know, to wait before they can actually play sport again?
I think so. So the outcome is quite. So after bunion surgery, most patients have definitely less foot pain and are better able to participate in everyday activities. But as I mentioned, it takes about up to 1 year, depending on how much they follow the doctor's instructions and how much they observe the post-operation indications. So
right.
Yeah.
And what's involved in the post-surgery period? Like, are they generally on crutches for a few weeks, or?
Yeah, definitely. And also shoe choice also important.
Okay, all right.
Yeah.
Cool. No, that's really good. Now, guys, do you have any questions at all? Do you, anything else you want to ask Frank? We'll give you another minute and pop your questions in if you have any. We'll be more than happy to help you. So in the meantime, Frank, if you just give us, so if you guys are suffering from bunions and if you want to get some help, obviously Frank is the person to see. So tell us again, Frank, how can people get in touch with you? Maybe phone number and.
So you can make an appointment online on my homepage, the www.smilefootcare.co.nz, or call me 577-3668, 577-FOOT.
So I'm just going to type it into the chat box. So it's 09577
3668.
Okay, great. Great. So I'm just I'll put those details in the chat box. So if you guys need any help with bunions or any other foot problems that you may possibly have, what are the other issues that you can help people with?
So many people present in my clinic with foot pain such as plantar fasciitis, Achilles tendinopathy, peroneal tendinopathy. So there are various types of foot pain. So if you have any pain or concern in your feet or leg, feel free to contact me. I will try to help you to return to your normal activities.
Great. That's good. That's great. Okay, so I'm just going to check if they have any questions. Okay, I don't think that's. I think that's basically it. So no, that's great. So Frank, thank you again for coming in tonight and sharing your valuable knowledge. And hopefully, if anyone needs any help with their feet, they can get in touch with you. And all the participants, thank you for your time as well for coming along tonight. I think, yeah, okay, no, that's fine. And we'll see you again in a couple of weeks. We'll run another webinar. We're doing those webinars every 2 weeks. So we'll see you again on a different health topic. And that's it for tonight. And see you next time.
Thank you. Bye.